Hello, I'm Amanda. I'm one of the PA students from Duquesne here at the office, and I'll be doing your exam today. Can I confirm your name and date of birth?
Libby Curtis, 9/1997.
Okay, nice to meet you, Libby. So like I said, I'll be doing your exam, which includes a full nervous system assessment. I'll have you start by filling out this form with me, and then I'll check your reflexes, have you move around a little bit to assess your motor function, and then also assess your senses and how well you feel touch and some of the nerves in your body as well. Do you have any questions? Okay. Wash my hands with Purell before getting started. So while I go through this mini mental status exam with her, I would be looking at her level of consciousness to make sure she's alert. I would be looking at her dress and her hygiene habits to make sure that they're appropriate. I would also be looking and assessing her thoughts and perception, her insight and judgment, and making sure that her mood and affect are congruent. While speaking with her, I would assess her speech for fluency and also note if there's any psychomotor agitation or retardation throughout the exam. Okay, so we'll get started with the MOCA form. Okay, so like I said, I'm going to be going through this form with you. It's going to assess some of your mental function, such as memory, attention, language, and all that. Like I said, I'll be guiding you through with instructions, so if you have any questions, let me know. And can I get your highest level of education?
A bachelor's degree.
Okay. So the first exercise that we have here is there's some bubbles with numbers and letters, and I'll have you draw lines connecting the bubbles in ascending numerical order and also alphabetical order. So starting with 1A, 2, and I'll have you continue connecting the bubbles in that order. Okay. So continue, have you do some more drawing, and if you could copy the cube to the best of your ability. Thank you. So this next part, I'll have you draw a analog clock with all the numbers and put the hands at 10 past 11. So now I'm going to have you name some animals for me. So starting with this one, what animal is that?
A lion.
Yep.
A rhino. A camel.
Okay, perfect, thank you. So I'm going to list you a bunch of words, and I'll have you repeat the words after me in the same order that I give them to you. So face, velvet, church, daisy, red.
Face, velvet, church, daisy, red.
Okay, and we're going to do the same thing again. So I'll repeat them to you and you repeat them back to me. Face, velvet, church, daisy, red.
Face, velvet, church, daisy, red.
Yes. So now I'm going to list some numbers and repeat the numbers in the same order that I give you. So 2, 1, 8, 5, 4.
2, 1, 8, 5, 4.
So I'm going to give you 3 numbers and have you repeat them backwards to me. 7, 4, 2.
2, 4, 7.
Okay, so this next part's a little silly, but I'm going to list a bunch of letters in a row. Every time I say the letter A, give me a single clap like that, and I'll tell you when to stop. F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, now we're going to do a little bit of math. So starting with the number 100, I'm going to have you subtract 7, and then from the new number, subtract 7 from that, and keep going down until I tell you to stop. Okay, so 100.
93. 86.
Yep.
79. 72. 65.
And you can stop.
Okay.
Good job. So now I'm going to be looking at some of your speech. Please repeat the following sentence after me. I only know that John is the one to help today.
I only know that John is the one to help today.
Yes. And then we'll do one more. The cat always hid under the couch when dogs were in the room.
The cat always hid under the couch when dogs were in the room.
Perfect. So next I have my watch. I'm going to do it for 60 seconds. So name as many words that start with the letter F as you can, and I'll tell you when to stop. So starting now.
Food, friends, family, funky, fresh, frenzy, fire, fake, flood, fire, I already said fire, fern,
yeah,
fluffy.
Okay, so for the sake of time, we'll say that that's 60 seconds. So now I'm going to give you 2 words and just tell me the similarity between the 2 words. So for example, if I said banana and orange, you would tell me that they're both fruits. So train and bicycle.
Transportation.
Watch and ruler.
They measure things.
Okay, so remember those words I had you repeat 2 times. If you could list any that you remembered in any order is fine.
Face, velvet, church, daisy, red.
Okay. So she got all 5. If she's having difficulty recalling them, I could give her a category cue or multiple choice cue too. Okay, so this last part of the form, I'm going to ask you just a couple questions. So what day of the day? What is the date?
March 16th,
Yes.
2020.
Yeah, 2020. And what is the day of the week?
Monday.
Yeah. And where are we right now?
My car.
Yeah. And what city are we in?
Pittsburgh.
Okay. So that completes the mini mental status exam. The total number of points is out of 30, and 26 and above is considered normal. Okay. So next I'm going to be doing the cranial nerve exam, 1 through 12. Have you hop up on the table for me? So we're going to start with cranial nerve 1, which is the olfactory nerve. So we'll start by checking the patency of the nostrils. So can you press down on one nostril for me and blow out the other side? And switch and press the other, blow out. So your nostrils are patent, so we can go along with the test. So I'll have you press down on one nostril again and close your eyes, and I'm going to put a scent under your nose and just tell me what it smells like.
Vanilla.
Yep. Get open. And now press down on the other nostril and close your eyes again. And here's another scent. And what do you smell?
Coffee.
Yes. Very strong.
Very, yeah.
Okay. So next we'll assess cranial nerve 2 by doing a full visual assessment. So I'm going to be checking your vision with this chart. And you can hold it here for me. And now read the lowest or the smallest row of numbers that you can.
3, 7, 2, 8, 4, 6.
So that's 20/20. And if the patient had any visual deficits or is different than their baseline, we could assess each eye individually and with or without contacts or glasses. So now I'm going to assess the pupillary reflex. So I'm going to shine this light into your eyes, but just keep looking straight at me. So I'm looking at if the pupil constricts directly, and then looking at the opposite pupil to make sure that it's also constricting with the light. So direct, and then looking at the opposite eye, and then do it on the other side. So looking at direct, and then making sure that the other one also constricts. So the pupil is intact. So now I'm going to be doing the peripheral visual exam. So I'm going to be having you mirror me and cover one eye. I'm going to be wiggling my finger, and when you start to see my finger in your view, just say now. And then keep this eye looking with me.
Now. 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 Now.
And then I would do that bilaterally. And then the last part of cranial nerve 2 is a fundoscopic exam. So I'll go on the patient's left, with my left hand, and so you can just look straight ahead, stare at something on the wall, straight ahead. Okay, so I would be noting that the red reflex is there and looking at the vessels in the eye, and that would also be done bilaterally. So next, I'm going to be assessing cranial nerves 3, 4, and 6 by doing the extraocular eye movement exam. So I'm going to put my fingers together, and I'm going to be moving one of them, and just follow my finger with your eyes. So all the extraocular eye movements were intact, so we can move to cranial nerve 5, which is the trigeminal nerve. So I'm going to be starting with the light touch. So I'm going to be doing the light touch on all branches of the trigeminal nerve. So I have my cotton swab. You feel that? That's what it feels like. I'm going to have you close your eyes and do that on your face, or touch lightly on your face, and just tell me when you feel the tapping. Okay, so close your eyes.
No.
Okay, you can open. It is tickly. So next we're going to be doing the sharp dull sensation on the trigeminal nerve innervation. So I'm going to be doing the same thing, except with this, we have the sharp sensation, which is that, and then the dull, which is that. And so just tell me if you feel sharp or dull. So close your eyes again.
Sharp. Sharp. Dull. Sharp. Dull.
Okay, you can open. And the last part of the trigeminal nerve exam, I'll have you clench your jaw for me, like this, and I'll palpate over the masseter muscle to make sure that the muscle tone is intact, which it is. Okay, so for cranial nerve 7 exam, which is the facial nerve, I'm going to have you do some facial expressions for me. So can you raise your eyebrows as high as you can, and lower them, and then smile big. And then I'll have you close your eyes, and I'm going to be pulling up on your eyelids, but just try to keep them closed. Yeah. Okay, so that's cranial nerve 7. Cranial nerve 8, the vestibular cochlear nerve, we're going to be focusing on the cochlear portion. Okay, so for this, we're going to be doing the Weber-Renais test. I'm going to ring this tuning fork and put it on top of your head, and just tell me if you hear the ringing better in one ear or the other, or the same in both. Equal. Okay. The next part, I'm going to do the same thing, but put it behind your ear, and when you stop hearing it, tell me. I'll bring it around front to your ear, and then tell me again when you don't hear it. Okay, ready? Yes. I'll be timing this. So now I'm going to be doing the rubbing test. So I'm going to rub my fingers out here. I'll have you occlude your opposite ear and close your eyes. And then when you don't hear the rubbing anymore, let me know. Okay, so close your eyes. Yep. Okay. So for cranial nerves 9 and 10, would be assessing the patient's voice quality throughout the exam, and then I'll examine the back of the pharynx and uvula to make sure that they're symmetrical, and upon phonation that they rise symmetrically. So can you open your mouth for me? And can you say ah? So they rose symmetrically, and I could use a tongue blade if I needed to push the tongue out of the way. While we're here, I'll assess for the hypoglossal nerve or cranial nerve 12 by having you stick out your tongue to make sure there's no deviation. And then you can dig it back in. And then for tongue strength, I'll have you put your tongue in the side of your cheek, and then I'm going to press and just resist my motion. Yep, and then other side. Yep, so tongue strength was intact. And then the last of the cranial nerve exams is cranial nerve 11. So I'll have you shrug your shoulders for me, and then I'll palpate the trapezius muscle. Okay, that's good. And then when you turn your head to the right, and I'm going to resist you and just try turning your head to the left. Yep, and then now turn to the left and back. Yep, so that assesses the strength of the SCM muscles. And then I would also, as part of the cranial nerve 5, I would have done the corneal reflex with the cotton swab, but not going to be poking your eye. So that wraps up the cranial nerves 1 through 12, and we'll be going on to reflexes. So I'll have you swing around. Okay. So now I'm going to be doing the upper extremity. So I'll start with the brachial. So I'll have you completely relax your arm so that all the weight is in my hand. I can feel it too. Ooh. So that's a very good bicep reflex. So now we'll do the brachioradialis. So I'm just going to tap again. Another good one. We could see the reflex. So now I'll do the triceps, and I'll have you kind of do like a robot arm hang for me, and you can put all your weight onto my arm. Good. And this is for the triceps. Nice. So that one is a little bit more subtle, but you can see, yeah, and that was a bigger one. As well. So now we'll move on to the lower extremity reflexes. Heavy. Yeah, take off your socks for me. Thank you.
Do I want to tilt it down a little more?
Yeah. Okay. So we got both of us in the view. start with the patella reflex. Make sure to get out of the way. Okay, I'm just going to tap on your knee. A subtle one. There's a bigger one. Make sure. And then to be doing the Achilles reflex, prop your foot up on me. And I could feel the foot flex against my thigh. And then we could also assess for the any clonus, which is in disorders such as Parkinson's, Huntington's, Lewy body dementia. And an example of clonus activity is asterixis, which is in hepatitis people. So have you hold out your hands, and if they had it, they wouldn't be able to sustain this, and it would droop down. Move on to the sensory part of the exam. We'll start out by testing the vibration sound. So with the vibration fork right here, I will be placing this onto the patient's distal interphalangeal joint. For this test, we move distal to proximal because if the sensation is intact distally, we know that proximally it's intact as well. So I can have you put your hands palm down on your thighs. Perfect. So as a test run for the patient to make sure that they don't mix up the pressure from the tuning fork as the vibration, you do a test run. So this is what it feels like when it's vibrating, and this is what it feels like when it's stopped and it's just there. Okay, so for this part of the exam, I'm going to have you close your eyes. I'm going to put this on your joint and just tell me when you feel the vibration stop. Yep. Okay. So we do this once on the upper extremity, and then now on the great toe for the lower extremity. So I'm going to repeat this again, then do the same thing, but just on your toe. Okay, so close your eyes. So that completes the vibration testing portion. Next up is the light touch, and I'm going to combine this with the point localization test as well. So I'll be doing the light touch on the upper extremity, but you would of course do it on upper and lower. Okay, so I'm bringing back my cotton swab, which we used prior in the exam. So I'm going to lightly tap your skin like this. When you feel that on your arm, not only tell me that you feel it, but point with your opposite arm to where you felt the cotton swab. Okay? So you can close your eyes and I'm going to get started. So that's the C5. Yep, that's the axillary nerve. And can you put your hands palm down on your thighs? Perfect. Actually, yeah. So that's the radial nerve. It's the opposite axillary. And have you flip your hands over, so palms up. Alright, that's C8. C6. C7. And that's the median. And the ulnar nerve. So the median on that side. And the ulnar nerve on that side. You can open your eyes. So that completes the point localization and light touch exam. Next, I'm going to be doing the sharp dull on the lower extremity. So for this, same as before when we did it on your face, we have a sharp side which feels like this, and a dull side which feels like this. So on your legs, I'm going to be tapping you, and just let me know if you feel it sharp or dull. Alright, and once again, I will tell the dermatomes that I am testing. All right, you can keep your hands up, perfect. And close your eyes.
Oh, sharp.
Yeah, so sharp, that's the lateral cutaneous.
Sharp.
Yep, and that's the sciatic.
Sharp.
So it's common peroneal.
Dull.
Yep, dull for common peroneal.
Sharp.
That's the femoral.
Sharp.
That's L4.
Dull.
That's S1.
Sharp.
S1 with the sharp.
Sharp.
L5.
Dull.
L4.
Sharp.
L5.
Sharp.
And then S1. So you can note that I made sure to do the sharp sensation on all the dermatomes because that is the true test. The dull is more like a baseline, just to make sure. And you do both of these, the light touch and the sharp dull, in a completely random order so the patient can't predict where you're gonna test. Alright, so now I'm going to be doing the position sense test. For this, I'll be making sure to hold the distal joint of the hand or the great toe laterally so that it doesn't cheat the test and the patient can feel the pressure. Okay, so I'll have you put your hands flat on your, like this, perfect. So for this, I'm going to hold your index finger. So this is the neutral position. When I bend it down like this, that's down. Up like this, it's up. So I'll have you close your eyes and just tell me which position you feel your finger in. Okay, ready?
Down. Up. Down.
Yep.
Neutral.
Yep.
Down. Neutral. Up.
Yep. And then I'm going to repeat this just on your toe. Right, you can close your eyes again.
Down. Neutral. Up. Neutral. Up. Down.
Yep. So that completes the position sense. So now I'm going to test for stereognosis by giving the patient two common objects, and they're allowed to roll it around in their hand, and they'll just have to name the object. Okay, so have you open up your hands. I'm going to place a object in one hand. Just tell me which object that you feel. Okay, close your eyes. You're allowed to roll it around.
It's a quarter.
Yep. Good. And now keep your eyes closed.
It's a binder clip.
Yep. So the patient was able to correctly identify the objects. So now I'll be testing for graphaphasia by using a capped pen and drawing a letter or number the same way that the patient is facing, and they just have to identify what I drew. Okay, so for this, have you put your hands up like we've been doing. I'm gonna trace either a number or a letter into your palm. Just tell me which letter or number that is. Okay, close your eyes.
Three.
Yep. 6. Yep. can open your eyes. This patient could correctly identify the numbers that I traced. All right, the next sensory test is 2-point discrimination. So for this, I'll be using my handy dandy paper clip. And on the patients, the pads of their fingertips will be pressing and slowly working my way in, and then they'll just tell me when they feel only one spot versus 2 places. All right, so have you open your hands, palms up. I'm going to be pressing lightly with this paper clip. Just tell me if you feel 2 points of pressure or only 1 point. Again, eyes closed. 2, 2, 2, 2, 2, 2, 2, 2, 2, 1. Okay, you can open your eyes. So the patient was within normal limits for the 2-point discrimination test, which is within 5 millimeters. All right, the last sensory test that I will be doing is testing for extinction. So I'm going to go on and stand behind you. I'll tap on your shoulders, and I'll either do your left, your right, or both. Just tell me which shoulders I'm tapping. Okay, so close your eyes. Both. Right, left, both, left, right, both. Yeah. So there was no extinction. And that completes the sensory exam. So next we'll be moving on to the motor and gait coordination tests. So I'll have you stay seated, and I will first inspect the patient for any muscle hypertrophy or atrophy, any asymmetry, or any involuntary motor movements as well. Next, I will test for muscle tone by passively moving one upper extremity and one lower extremity and feeling for the slight resistance, making sure that there's no excessive flaccidity or rigidity. All right, so I'm just going to have you completely relax your arm so that all your weight's in my hands. And so muscle tone is normal. And since the patient is seated, her legs are already completely relaxed. I can move the lower extremity as well, feeling for that slight resistance. So again, muscle tone. Now I'll be testing for muscle strength, and this test is best if you can do it side to side as much as possible to compare both sides. So I'll start with the upper extremities and work my way down. All right, so can I have you put your arms out like an airplane and just resist my pressure. All right, and then out like you're showing your muscles off. And resist, 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 resist. All right. And then for your wrists, you can put them out like this. And then resist me up, resist me down. And then put your hands out. And resist, and resist. And then can you give me an okay sign. And don't let me break it. And then squeeze my hands as hard as you can. Testing for grip. So now I'm going to move on to the lower extremity. So I'm just going to slide my hand under. And so resist, and resist, and resist, and resist, and resist, and resist. And then toes up to the sky, and then pedal to the metal down. Again, I would do that bilaterally. So that completes the strength testing, which the patient had at 5 out of 5 strength. So now we'll go on to the rapid movement part of the coordination test. So So I'm going to have you place your hands face palm down on your thighs, and flip them over so your palms are up, and then back, and then keep repeating this motion and see how fast you can get it. So the patient can clearly do this with ease, and it's a nice smooth motion. All right, you can stop. So now I'll have you do a similar thing, or tap each of your fingers to your thumb. See how fast. So again, patient can do that quite easily. All right, stop. So for this next part, have you swing just slightly to the side for camera. Okay, so for this, have you use your pointer finger and touch your nose, then touch my finger, and then back to your nose, and then keep touching my finger. And then now close your eyes and see if you can do it. All right, you can open your eyes. So now we're going to do the same thing, except I'm going to be moving my finger all around and just keep touching my finger. Ready? Okay, good. So the patient was able to track the motions. And so next, we're going to have the patient stand up. All right. So we're going to be doing the Romberg test. So have the patient stand just feet together, but like shoulder width apart. And so I'm going to have you close your eyes for at least 30 seconds. I'll be here to catch you if you ever feel dizzy. And we can start. So close your eyes. And we're looking for any abnormal swaying. A little bit of motion is normal, but making sure that the patient can keep their balance. And we'll say that that's 30 seconds. You can open your eyes. Now we're going to do the pronator drift test. So I'll have you hold your arms out with your palms up, and have you close your eyes again for another 30 seconds. And here we're looking to see if the patient's arms go into pronation, which they're not, so you can open your eyes. So now I'm going to assess how you walk. We're going to look at some different gait tests. So I'll have you stand here next to me. And just have you walk normally down to the table. And then stop once you get to the end. And then on the way back, you can do some heel-toe walking. So like you're walking on a tightrope, one foot in front of the other. Yep. And you can stop and then walk back to the table, but on your heels. All right, and then come back to me, and then on your tiptoes. Nice. And then now, have you stand next to the table. You can use this to brace yourself, and just have you drop, hold one foot up, do a shallow bend, just like that. Yep. And shallow bend. Good, and then lift the other leg up, and again, a shallow bend. All right, so now have you hop up on the exam table. So I'll have the patient completely supine, and I can complete the monofilament test, which looks at peripheral neuropathy. All right, so I have this little plastic stylus. I'm going to be lightly tapping it on the bottom of your foot and just giving a shout when you feel the pressure. And then that would be done bilaterally, and we're looking to see if the patient can feel it before the monofilament bends. And then while we're down at the foot, we can do the special sensory reflex.
and doing the Babinski sign. So I'll use my tongue depressor and lightly press on the bottom of the patient's foot. Then we'll look to see if the toes curl or if they fan out, and we're looking for curling because that's the normal finding in an adult. All right, so I'm just going to scrape the bottom of your foot. Sorry for tickling you. But we can see that the toes did not fan, so that's a normal finding. Alright, the last reflexes we're going to do are the meningeal signs. So we'll do the Koenig sign, where we put the patient's leg into 90-degree knee flexion and 90-degree hip flexion. And then I'm going to try to straighten your leg out. Let me know if you have any pain. Alright, so there was no pain elicited and there was no limited range of motion or extra rigidity upon extension. The next is the Brzezinski sign. So I'm going to passively raise the patient's neck up and then look for any knee or hip flexion. All right, I'm just going to lift your head up. And there is no signs of that, so that is a negative finding. And that completes our full neuro assessment. Thanks for watching.